Next is the pituitary gland, which is located in a bony cavity of the sphenoid bone of the skull called sella turcica. Now, this is attached to the hypothalamus, that is on the inferior surface, by a stalk called infundibulum, and anatomically, the pituitary gland, the hypophysis is divided into two parts. We have seen here, we can be able to see from this block diagram, and before that, let us tell you, this infundibulum or the stalk is absent in the mammals. Now, pituitary gland is divided into two types. This is the adenophysis and neurophysis. And pituitary gland is also known as hypophysis. Hypophysis. Okay. Now, this adenophysis, it consists of about 75% of the pituitary gland, and it is highly cellular and vascular in structure. It consists of two portions. It consists of the main two portions. Actually, this is the three portions: pars turalis, pars distalis, and pars intermedia. Now, these two portions are almost merged in humans. Last two portions, that is pars distalis and pars intermedia, and it is in the oral ectoderm. Adenophysis is in the oral ectoderm region. The neurophysis, it is in the neural ectoderm. It consists of the pars nervosa and the median eminence, and this is in the posterior lobe. So, the pars turalis is in the anterior lobe, and pars distalis is in the anterior lobe, and pars intermedia lies in the medial lobe. So, hormones, I have already told you in the previous classes that how to define the pituitary hormones. So, this is the flat peak. This I should not be considered, and F for FSH, L for LH, A for ACTH, adenocorticotropic hormone, T for TSH, P for prolactin, and G for GH is the gonadotropic hormone. And the middle lobe is the MSH, and in the posterior lobe we find the oxytocin and vasopressin. They are actually synthesized by the hypothalamus, and they are transported axonally to neurohypophysis. Now let us study the hormones of the pituitary. Now we have divided into four columns. Four columns there. The parts of the pituitary. First, these are the parts of the pituitary. Next is the hormones they are produced. Now, principal actions they perform, and target organs, in which organs they act. So, now GH, the gonadotropic hormone, it is under the adenophysis, the parts of the pituitary adenophysis, and from the adenophysis the following hormones: GH, TSH, ACTH, MSH, PRL, FSH, and ICSH, including LH also, these hormones are produced. Now, GH, its principal action is, it is a growth, it helps in growth of the body, it helps in protein synthesis, rather it stimulates protein synthesis, and it inhibits the protein breakdown, it helps in hydrolysis of the fat, and retards use of blood glucose ATP production, and it target organs is general. Now, thyroid stimulating hormone of the TSH, it controls secretion of the thyroid hormones, and its target organ is thyroid gland. ACTH, it controls secretion of the adrenal cortex hormones, and it is glucocorticoids, and its target organ is adrenal cortex. MSH, it stimulates the cutaneous pigmentation by dispersion of melanin granules, and its target organ is the melanocyte of the skin. And the PRL, it stimulates production and secretion of milk. Its target organ is the mammary gland. FSH, the follicle stimulating hormone, it acts both in male and female. In male, what it does, it stimulates spermatogenesis, and in female, it stimulates growth of ovarian follicle. It acts on the gonads. ICSH, that is the interstitial cell stimulating hormone, and it is found in male, and it secretes testosterone, and its target organ is the gonads. And LH, the luteinizing hormone, in female, together with the FSH, it triggers the ovulation, and it stimulates conversion of ovarian follicle into corpus luteum, and its target organ is gonads. Now these are the hormones which are produced by adenophysis and neurophysis. They are oxytocin, we write it by OT also, vasopressin or ADH. Now oxytocin stimulates, so let us study some points about oxytocin. Actually, oxytocin is hormone which acts on the smooth muscle, and you can note it down what I am saying. It is a hormone which acts on smooth muscle, and it stimulates the contraction in females. It stimulates a vigorous contraction of the uterus at the time of childbirth. It also causes contraction of mammary glands, leading to milk ejection, widening of the uterus near the completion of pregnancy. Suckling of nipples by young infants stimulates the hypophysis to release the oxytocin. The oxytocin-induced contraction of the mammary gland muscles help in the flow of stored milk from the mammary gland to the mouth of the sucking infant. Even sight and sound of baby can cause a nursing mother to secrete this hormone. Therefore, oxytocin is also called milk ejection hormone or the birth hormone. And in vasopressin, now a question may come, why oxytocin is called a birth hormone? You can write this answer, what I've told you, and you can add in some points here. Because it stimulates the rhythmic contraction of the uterus during childbirth. It is also called milk ejecting hormone because it stimulates the ejection of milk from mammary glands. Now, vasopressin, we call is ADH, it is antidiuretic hormone. It mainly acts on kidney and stimulates the reabsorption of water and electrolytes. Now, this ADH acts on the nephrons of kidneys and stimulates the reabsorption of water from the distal tubule, that is in the distal columnar tubule and collecting tubules. It thereby reduces the water loss from the body. Hence, it prevents this water loss is also known as diuresis, and hence it is called antidiuretic hormone. So now, if there is a failure in the secretion of vasopressin, it leads to reduced renal reabsorption of water and a consequent elimination of a large volume of dilute or the hypotonic urine. And concentrated urine is called hypertonic urine. So here, it's elimination of a large volume of very dilute hypotonic urine, and this disease is known as diabetes insipidus. Although the volume of the urine is increased, no glucose appears in the urine of such patients. Besides its antidiuretic effect of reducing the urinary volume, vasopressin also enhances the arterial blood pressure by causing constriction or narrowing of the arterioles. Now, so here what we have written some points here. The oxytocin, it stimulates the contraction of the uterine muscles during birth. So uterus and mammary glands. And vasopressin, it stimulates the absorption of water and reduces urine secretion. It also stimulates constriction of blood vessels, thus the blood pressure increases. And its target organ is kidney and blood vessel. Now let us study the difference between the vasopressin and the oxytocin. Now vasopressin, it is a vasoconstrictor, okay, and oxytocin, what it does, now it stimulates the contraction of uterine muscles during birth. Okay, this is point number one. And next is vasopressin. It tends to increase the blood pressure, and in oxytocin it causes ejection of milk from the mammary glands. Now again in vasopressin, it is helpful. It causes ejection of milk from mammary glands in oxytocin. It is helpful in concentrating the urine. And whereas oxytocin has no such activity. It has no such activity. Its secretion is stimulated by reduced quantity of body fluids in vasopressin, and in oxytocin, its secretion is stimulated by distension of uterus and sucking of breast in females. Here all the hormones of the endocrine glands and their secretions are given. We have studied till now. So I think now we need to study before going to the pancreas, you can study this table also. This table contains all the hormones, that the chemical nature, their functions and disorders in case of hypersecretions or hyposecretions. So due to shortage of time, you can pause the video and note it down from here. Okay, different sections you can note it down. This is a very important table.